Enabling comes up a lot with parents and young adults. So you'll often find that young adults will get addicted to something, and let's say it's a heroin addict, because heroin is big these days, as we know, and the parent will be afraid that something bad will happen to their child, so they will continue to give them money. They will give them a place to live. They will make excuses for their child. They will clean up the messes after their child. But what happens is that it prolongs the process of addiction, because the child never gets the consequences of their behavior. So until that child gets the negative consequences of their addictive behavior, nothing is going to change. So that's what we call enabling behavior. And you parents often do it because they're concerned. They don't want their kid to be homeless or without money or living in the car, but sometimes that's what has to happen in order for someone to know that they need help.
Sure, well-meaning parents give and give and give in efforts to help their child, but eventually what they do is they make the situation worse.
Yes, definitely. I'm sure you've seen that too.
Yeah, absolutely. In the rehab that I work in, they call it the golden wheelchair.
I love that term.
And really what it is, all these resources are given over and over again, but it really kind of stunts their growth. They're stuck, they're unable to really get up and walk and be on their own. So all this enabling, all this money, all this time that's spent does not offer, positive results. It usually backfires.
Yes, and we have to, as clinicians, have to help these young people kind of grow up in a way.
Absolutely.
So, become responsible, take responsibility for their behaviors, find out who they are.
Absolutely.
Also outside of the family system.